my name is Hamrita Dinjal, and I'm applying for the MS in Speech Language Pathology at the University of the Pacific. I'm originally from Toronto, Canada, and I'm interested in pursuing this program in California. Currently, I'm volunteering at West Park Healthcare Center, which is a long-term care hospital in Toronto. And basically, I deal with patients who have dysphagia, and I monitor their speech and swallowing so that I can help them interact with each other and have lunch together in a socially interacting way to help manage their speech and swallowing disorders. I pursued an undergraduate degree in psychology, and although this is not a communication sciences and disorders degree, I feel like it has well equipped me to be prepared to deal with people in a speech language pathology setting. Apart from my academics, I'm a self-proclaimed storyteller, and I love reading stories, writing stories, and just going to libraries. And I really think it's important to be able to tell your own story, which is why I think being a speech language pathologist is really important, because everybody should be able to tell their own story and be able to communicate their needs so that they can improve their health, functioning, and quality of life. Within the next 2 to 3 years, I see myself as a SLP focused on helping individuals with speech difficulties so that they can improve their physical, psychological, and social functioning. In response to the second question, I would say that I would immediately ask the child if I should open the door, because they went to the corner of the room as soon as I closed the door. Then I would try to make eye contact with the child, so I'd get on their level and make eye contact with them so that we're on the same level and the child is not looking up at me, and it will help them feel more comfortable. And once I can make sure that the child is not scared or afraid of the situation, I can start listing solutions until he or she agrees on the solution, and that we can agree on something that would be helpful for him. And I would also ask the child if he would rather leave the room and go for a walk, or maybe get a snack so that we can continue the session. And if the child is not responsive at all, I would try to think about whether if this is an issue with comprehension, then I would try to use symbols or hand gestures or some other form of communication to try to communicate with him. I also might get the child to draw pictures so that they can communicate how they're feeling to me, and I can better understand why they immediately moved to the corner of the room and were not responsive towards me. In answer for the third question, I believe that the University of the Pacific's program is right for me, because I'm really interested in going to an institution committed to academic excellence and excellent opportunities for clinical experience. One of the things I'm most interested in working with the University of the Pacific is going to their Pacific Speech, Hearing, and Language Center, because I believe that it would help me gain clinical experience that would help me take a biopsychosocial approach to patient care. I'm also interested in working with faculty such as Larry Boyles, because of his work on using therapy groups to manage aphasia aligns with my academic background in psychology and an interest in taking patient-centered care. Thank you so much, and I hope to hear from you soon.